Hi, everyone. Welcome to another Dolphin Financial Radio Show. I'm Dan Wendell, your host, and I'm from Dolphin Financial Group. Today, we're going to be talking about high deductible health plans. Yes, health insurance. Ugh. No, every year people have open enrollment, and this is the time of year. As soon as the summer ends, people start thinking about their group health insurance, what they have to enroll in for next year. Come November, people are going to be open enrollment for the Affordable Care Act plans. You also have Medicare, but this is not for Medicare. So this is for people that are not on Medicare. But if you are on Medicare and you're watching this, you might learn something that you could share with someone else. That's the goal in life, isn't it? To improve other people. So today we're going to be talking about why you should consider a high deductible health plan for 2023. What am I talking about? You know who knows what I'm talking about? Tony Shore. There he is. Tony knows because I believe Tony has a high deductible health plan.
Oh, yes.
Work.
Yes.
And so, yeah. How you doing, Tony?
I'm doing good. I'm doing good, Dan. And, healthcare, I've been hearing that open enrollment is here for Medicare. Basically, this is the time of year for open enrollment. But you said we're not talking about that. We're talking about our high deductible healthcare plans.
Yeah,
HDHP.
we're talking about right. So employer group coverage health plans. And a lot of people usually around September, October, they have to make a decision from their employer. Hey, which plan should I pick? And a lot of times the company says, here's your menu. Pick which one you want. Here are the three choices. Some people have to choose, should I go on my spouse's plan or should my spouse go on mine? Factoring the family, which level of deductible do we need? So I'm hoping, now not every plan offers this. They're offered through the Affordable Care Act. So if you're on the marketplace, you have an option for a high deductible health plan. Why would you take it? That's what we're going to talk about today. But a lot of employers offer a high deductible health plan, not as many as I like. And there's a reason why I would want more to offer it. In fact, I think every health plan, every person should have an option to get a high deductible health plan. But I think the stats are less than 25% of employers offer something that goes with the high deductible health plan. Let me, what are we talking about here first? Let's take a moment to, what is a high deductible health plan? All it means is that the deductible, or what you pay before the insurance kicks in, is high. Well, what does that mean? So I put on here the 2023 minimum deductible. To be considered a high deductible health plan, your individual deductible has to be $1,500 or more. And the family deductible has to be $3,000 or more. Now,
and nowadays, Tony, that's not even the highest of deductible insurances.
No, definitely not. You have 3 children. Your oldest child is still under 26. Is he still on your medical?
Yes.
Okay. Yes. So your family deductible is the minimum it could be for the family is $3,000, $1,500 per person, $3,000 for the family.
Yep.
That's the minimum. Now, if
I think ours is like $2,000 per person and $5,000. Ours is $5,000 for the family, I think.
Yeah. So that would qualify for the deductible amounts to be an HDHP plan. Now, what does that mean? Now, if your oldest son gets a job that covers him and he comes off of your plan, you still have the same family deductible. If all 3 of your children go and get their own plans, you still have the family deductible.
I know.
So the family is 2 or more. There's not like you get an additional, right? For every kid that you have on the plan or every family member. Okay. So people get that. But right away, people are like, well, $1,500 deductible. That means I have to pay the first $1,500 out of pocket before the insurance even starts kicking in. Yes. People like zero deductible plans because the insurance kicks in right away. But what do we know about zero deductible plans versus a $1,500 deductible plan?
Usually they cost more.
They cost more per month.
Yes.
So when you're looking at
you
these,
can't get an HSA.
oh, Tony,
Right?
jumping ahead. He's stealing my thunder.
That's the purpose of the high deductible. That's the only reason. Well, it's one of
Well,
a couple of reasons, right?
let's
That you'd
let's look
want a
at
high.
let's take a broader picture for a moment before we get into the HSA. If you get a high deductible plan and now your deductible's $2,000 a person versus zero, you're saying to yourself, well, I have to chip in the first $2,000 of health insurance. So if I go to see the specialist, I have to pay the full price, and he charges me $175. I got to pay that. I'd rather pay a $20, copay or something like that. The problem is when you get a plan with a zero deductible, the cost per month is extremely high comparatively, usually, to the high deductible plan, because the insurance company's going to charge you more upfront for that because they have to put in money right away. So it's a balance. And it's in the end, it's who's taking on more insurance. And then if you're giving the cost or the burden of the insurance on the insurance company earlier, then they're going to charge you earlier, right? They're going to charge you more for each month. So it's a game. It's a balance. It's not like there's one right answer. So, but here's the other part of this. So your deductible, it's got to be higher, but so there's a limit on the upside out of pocket in order to be a qualified high deductible health care plan, which is counterintuitive. There's an out-of-pocket maximum on health insurance. A lot of people have out-of-pocket maximums. You can have a $5,000 out-of-pocket maximum. You can have an $8,000 out-of-pocket maximum. You could buy health insurance, excuse me, that is got a $25,000 out-of-pocket maximum. You could do that. Now, it's not going to be on the health ACA plan because there's limits, but there are private health insurance companies that will give you a plan, and it's a lot cheaper, but your maximum out of pocket's $20,000. That's a lot.
Yeah.
But the monthly cost is so low. So if you're super healthy, you're like, yeah, that's kind of a catastrophic plan, they're known as. So, but looking at the requirements that I'm interested in to be considered a high deductible health plan that's HSA compatible, the maximum out-of-pocket limit, not the premiums, the what you put in for services, including copays and deductibles, all throughout the year, the maximum you can put out is $7,500 as an individual, $15,000 for a family. So if you have a high deductible health plan with a $20,000 max out of pocket for the family, it doesn't qualify for the main reason to get a high deductible health plan, which you've already alluded to, which is the HSA. By the way, Tony, I'm just going to put up the link to these numbers, where they're coming from. These are 2023 numbers. The IRS, you got to shudder whenever you say it. It's like Young Frankenstein, the movie. Every time a Frabluha was said, the horse would neigh. We should have a noise every time I say the word IRS. We should have a death gong. Anyway, the IRS puts out what they call revenue procedures. It's just a document, and I put the link here. So this shows you what the costs are. So those numbers are from the IRS that I just went through, and it was just an inflation adjustment announcement, basically. So they set these limits and then they increase it, and it was a fairly decent increase. I think it was over 5%. Probably should have been more for 2023, considering what inflation is. But anyway, if you're interested in reading this, you can go there. So why would you increase the potential out of pocket? Why would you go and say, I want the health plan that's going to raise the amount that I could potentially pay out? Why would I ever consider doing something like this? And the number one reason for my purposes would be that you qualify for a health savings account. Because if you buy a low deductible plan, a zero deductible plan, you can't get an HSA. You can't contribute to an HSA that year.
Right. And we know, if our listeners have heard your past shows, you are a big proponent of HSAs and utilizing them.
It's, I think, the number one financial tool available to people in this country. Number one. better than a Roth IRA. Wow. Right. So, but a lot of people also will say, well, I don't mind contributing and paying for a high deductible health plan because I'm healthy. I never use it. I don't go to the doctor unless I really have to. The only time I'm going to use my plan is if I'm in an emergency, if I get, in an accident, or I develop some debilitating disease, right? So that's why I maintain health insurance, but I really don't use it otherwise. A high deductible health plan might be good for them because the costs are going to be lower than all the other options. But couple it with an HSA, boom, you got yourself quite the deal. Now, what is an HSA? A health savings account. If you haven't seen the show,
why are they so good?
Number one financial tool. I'll put a link on the show we've done in the past on that. I'm sure I'll find one to link up there. So before I talk about what the value is, I want to say what the maximum you can contribute. The IRS in that same document increase the amount you could put into an HSA per year. It's, oh, look at that. There's a typo on there. It's $3,850 per person, a maximum family total of $7,750. So $7,750 is the maximum you can put in for a family. Okay, what does that mean? That means that you can take that much money each year, assuming you're on an HSA, a high deductible health plan, qualified high deductible health plan that falls in those limits we just went through. You can actually take money and put it in a health savings account. Well, what's a health savings account? It's like a trust account. It's an account at a bank. You'd go to any bank that offers them and open up an account, put it in. A lot of times the insurance companies that you buy your health insurance through offer one and say, here, you can use this one, and they open it for you. And you could take that money and you can invest it. You can leave it in cash. It's an account that's separate. And the reason why it's separate is because the IRS looks at it differently than your other accounts. But this is what you could put into it. There's also a $1,000 catch-up limit if you're over 50. So you can add an extra $1,000 if you're 60 years old, or, you get an extra $1,000 for the family if you're over 50. So it's not a bad chunk. It's, it's not as much as a IRA contribution.
And what are the advantages? Because it's tax free. You don't have to pay taxes on that money, and you can use that to pay off health related items like prescriptions and doctor visits and anything medical related.
Right. What are the advantages? So why would you do an HSA?
Even sunscreen. I heard sunscreen is HSA eligible.
I was thinking about that the other day. I just watched Jaws with my kids.
Oh yeah,
the original Jaws.
Yeah. We're gonna need a bigger boat.
People were clapping, including me. I kind of, it was my mom's favorite movie, so she always used to, it was her favorite movie.
It's a classic.
And they were talking about, I think they said, I'm just putting on suntan lotion. I used to call it suntan lotion, not sunscreen. So it's funny that you said that that's a medical thing, because it is, right? That's the whole point. But I remember putting on, like, to make myself brown. So, okay, there's 3 reasons why an HSA, why you'd get a high deductible health plan is so you can get an HSA. Why do you get an HSA? There's 3 reasons. Number 1 is taxes. Number 2 is taxes. Number 3 is taxes. Right? But more specifically, reason 1, contributions to your HSA are tax deductible above the line. What do I mean by that? So if you put in $3,800 into an HSA account because you have a high deductible plan that qualifies, you would basically take that off the top of your income. When you file taxes, it doesn't matter how much you make. There's no limit to your income.
That $3,800 would come right off the top.
And you don't have to itemize. It's just right off the top, just like an IRA contribution. But an IRA contribution, you can't deduct it if you make above a certain amount, right? Or if you have a 401k or something like that. But an HSA, it doesn't matter what your income is. You put in $3,850 into an HSA, boom, that comes right off your income. So if you make $50,000 and you take your standard deduction of $12,000, whatever that is, you could take another $3,800 right off the top of that, and you don't pay tax on it, right?
Which is great. But
it's great. Great. And with an IRA, you don't pay tax on it now, but then when you take it out later, you pay tax. Here, you don't pay tax on it. You get to write it off, right? So that's number one. It's a huge write-off that's available to everybody.
But my argument to that is, great, you don't have to pay taxes on that $3,800. It comes off, but you are the exchange in return for that. You're committing that $3,800. You have to spend it on healthcare needs.
You don't have to spend it on healthcare needs, but if you don't spend it on healthcare, you do get a penalty. Right. You have to pay taxes on it. But if you don't spend it on healthcare needs and you just let it ride and it doesn't go away, you can let this roll every year. You don't spend it. Eventually you'll get to be 65. And I mentioned this isn't for people 65 because you cannot contribute to an HSA if you're on Medicare. Even if you're on only Part A and you're still working, I'm on Part A, you can't put into an HSA. Not allowed.
You can pull out though. You can have money in an HSA still.
Exactly. So you could be in your 80s, have an HSA and use it. But I'll get to the big tip at the end. So going in, no taxes, it's an actual tax write-off. 100% above the line write-off. That's huge. There aren't many of those. Number two, withdrawals are tax-free if they're for medical expenses, like you said. So yeah, you're committing to using this for medical expenses. But I'll tell you what, Tony, everyone's got medical expenses. You just mentioned sunscreen, toothpaste, or dentistry, right? Or just going to see a doctor and
you can use it for, I think, eyeglasses. You can use it for like vision, dental, and hearing.
It's broader. You don't have to go to the hospital and see a surgeon to use this. You can use it for personal health care products. And it's got to be, but you just keep receipts. You just keep track of this. And a lot of times they'll give you a card, like a debit card associated with this account. So you swipe that, boom, it's there, right?
Yeah.
So they have to be qualified medical expenses. You're right. There is a catch, but everyone's got qualified medical expenses.
That's true.
And if you don't
especially as we get older.
Right. So if I could open one up as a 20-year-old in my first job and put money in there and not touch it because I don't have medical expenses. And if I do, I use cash and I forget about this and I let it grow and I invest it in the market and it compounds. When I go to take it out later, when I might need it, a big health scare or something, I could take it out tax-free. It doesn't count as income. And, it could be used to any medical expense in the future. And in the past, which I'll get to in a moment. The third major tax issue with this is the growth is tax-free. So I said it's in a separate account. You can actually invest the money. And if you turn that $5,000 that you put into it into $10,000 because the market does well over the course of time, all the gains you don't pay tax on either. So it's like a Roth IRA, except it's better than a Roth IRA because when you put money in a Roth IRA, you have to pay taxes and then put the money in. Here, you put the money in and you write that off. So it's better than a Roth. It's the best financial instrument if it's available to you, which is why you want to consider a high deductible health plan, especially if you can hold on to it for the long term and you can actually gain growth in it.
Right. And to me, the high deductible health plans always seemed not good, right? It's like, that's too high a deductible for our family. We've got a lot of, the kids are going in. Sarah and I are going in. I want everything covered, but I don't want to pay out of pocket that much. But adding the HSA, it really does make it worth it. And, you find ways to make it work.
Well, let's think about it in your case, right? So say you put in $7,000 and, you're at the 20% tax bracket, 22% tax bracket.
Right.
So you're getting 22%. What is that? That's $1,500, say, of tax benefit that you're not paying taxes on. So that goes in there. Now, are you exposing yourself to more than $1,500 of potential insurance out of pocket? Maybe. So it's a bit of a gamble whether or not you're going to use the high deductible, if you're going to meet the deductible or not. But that's going to be no matter what plan you take, when you're looking at the different deductibles and the coverage limits and the max out of pocket, you know, I think if you're not very healthy and you're constantly using it, maybe it doesn't make sense compared to another plan. But if you're an average person or relatively healthy, an HSA may be a powerful plan. And here's another little tip, secret usage of an HSA that might push you over the edge, Tony. And I don't know if you knew this. You want to save the medical receipts, and there's a reason for that. You can pull money from an HSA today for medical services that you had years ago. So now the key is your HSA had to be open prior to those medical expenses occurring. But here's an example. All right, Tony. Hey, I'm 40 years old. I don't need an HSA. You know,
right.
I'm like, you'll thank yourself in the future. You open an HSA. You don't even fund it. Let's say you put $100 in. And then 5 years down the road, you're 45 and you're like, you know what? Maybe this guy knew what he's talking about. Now I put in $5,000 and then you forget about it. Then 10 years down the road, another 20 years down the road, that $5,000 or 5,100 is now 15,000 and you're 65.
Because it can grow.
Or better yet, you're 63. Right?
Because it can grow, right?
If you grow, if you invest it. But even if it didn't grow and stayed at 5,000, but let's say it's worth 15,000, now you're 63. And you're like, okay, I'm retiring. I don't want to show income so I can get a high subsidy for the government. I'm going to get a health, do I get a high deductible plan until Medicare, right? But you need to have some income to live, but you don't want to show income for tax reasons, whatever those might be. We can only guess. You could say, you know what? I had surgery when I was 50. I have the receipt. I know I'm 63. I don't have any medical expenses today, but I want that $15,000. I want that $15,000 in my pocket. I don't want it in the HSA anymore. I want to keep my income low, but I need money to live. You could take the $15,000 out at age 63 to pay for the medical expense at age 50 that you still have the receipt for. I'm being dramatic with the timeline to make the point.
Right.
Because you opened the account when you were 40 or anytime prior to having the medical surgery at 50. So now you've got this tax-free gains and principal that you put in there. You use it for a previous medical expense that you haven't seen in years. Totally legit. You have the receipt, say, I'm taking it out for that. Boom, there you go. You're able to keep your income low, all because you opened an HSA years ago.
Wow. That's huge.
It is.
Yeah, obviously.
So the question ultimately, though, HSA is really powerful. Not everyone has access to it. So it's only for the select few that do. Is the extra insurance that you're going to have to take on worth the HSA? Won't my expenses, medical expenses today wash out the value of the HSA? No one knows. You just don't know. So I would err on the side of open it up, fund what you can. Worst case scenario, you hit your max out of pocket and you need the money now. You take it out. You got a tax break on what you put aside for it. And you're like, well, I wish my deductible was lower. Well, who knows, right? But it's a conversation you can have every year.
Yeah.
But open it. And if you have the option, really strongly consider it.
Yeah. So the conclusion.
I love HSAs. I can't get enough of them. Mm-hmm. If HSAs were a person, my wife would be jealous, right? Because I
get a little jealous as the co-host.
I admire it. I'm talking to you right now, but I'm thinking about HSAs. That goes for you, listeners. I love you all. My clients, I love you, but HSAs, I fell in love with first. No, and it's only available if you have a high deductible health plan, right? So that's the catch. I wish and I hope that the government will open this up to everybody. Wouldn't it be great? Because people can put it doesn't matter what kind of health plan they have, they could put money aside for health insurance expenses or health care expenses and not have to pay the government taxes on that, because everyone benefits from it. So I think everyone should have an HSA, but until that happens, you really got to consider a high deductible health plan for this benefit. So consider it for 2023. And if you don't know, if it's even available, open up the booklet or raise your hand at the benefits meeting that you all dread and say, do we have a HSA compatible plan? If you're going on the health exchanges in November and you're getting your health insurance through the exchanges, the Affordable Care Act, Obamacare, whatever you want to call it, there's a little button you could say, check, show me HSA compatible plans. There's going to be something there for you. Just consider it. That's the message today.
Yep. And you're really saving and investing in your future by doing an HSA.
Right. And like I said, it's the #1 tool. I can't speak highly of it more than I have. So, and so if you're listening, you're older, you're on Medicare already, and you're like, you've gotten this far, tell somebody about it. Tell your grandkids or your children, your adult children, and say, hey, you should consider an HSA. You really should, because eventually they're going to need health expenses eventually. Everyone, no one's perfect. Well, sorry, Tony, but most people aren't perfect. But the shout out to your grandfather. He recently passed away, 101 years old.
Yeah, we've talked about him on the show before. I've used him as an example because he lived happily and he was mentally sharp right up until the end. He died this past Monday. And on the Saturday, 2 days before, I got to spend an hour with him talking. He squeezed my hand. He was harder to hear and understand because he mumbled a little bit, but he was telling stories, specific dates, times, people, and he remembered what happened yesterday, and he remembered what happened 50 years ago and 100 years ago. So, well, not quite 100, but a long time. And so his memory was good, and the doctor said his body just gave up. But yeah, I mean, he lived a long, happy life. He beat Social Security wasn't happy with him. I'll tell you that.
right. And he died of old age. He didn't have a medical condition, but he had medical expenses, right? Everyone's got them.
Yes.
He went through a really long life, really healthy life, and probably avoided the doctors. But
he did.
Everyone runs into stuff, right? Everyone.
Yeah, the last 2 years, he's had a lot more doctor's appointments. As his body started to give out a bit.
So you'll have, and maybe we'll do another show on what happens to your HSA if you pass away with one. Because that's not something that your kids necessarily want, but your spouse will. But that's for another show. So anyway, consider the high deductible plan. Cheers to Grandpa, 101. Tony Shore's grandpa. What was his first name again? Bob.
Right? Grandpa Bob.
Cheers to Grandpa Bob, everyone. And if you're thinking about it in HSA and you like it, inquire. #1 step. You got to get the high deductible health plan first. Thanks for a good show, Tony. We'll catch you next week.
All matters discussed in today's show are for informational purposes only.
This show is not investment advice.
Dan Whittle nor Dolphin Financial Group are affiliated or endorsed by any government agency.
Investment advisory services are offered through Dolphin Wealth Management, Inc., a registered investment advisor in the state of Florida.
Insurance products and services are offered through Dolphin Insurance, Inc.
Dolphin Wealth Management, Inc. and Dolphin Insurance, Inc. are affiliated companies doing businesses as Dolphin Financial Group.
You should talk to someone at Dolphin Financial Group before implementing any of these strategies or ideas.